Welcome to NetSmart Care Threads, a podcast where human services and post-acute leaders across the healthcare continuum come together to discuss industry trends, challenges, and opportunities. Listen as we uncover real stories about how to innovate and improve the quality of care for the communities we serve. Let's get into the show.
My name is Jeremy Mercer, and I'm your host today. I serve as Director of Post-Acute Strategy for NetSmart, and I'm excited to introduce our guest today. Amy Goldsmith, Senior Vice President of Care Management for SavaSeniorCare. Amy oversees the care management and care coordination functional teams for SavaSeniorCare's 168 skilled nursing facilities. She has worked in long-term care for more than 23 years. Amy's passion lies within the care and advocacy of the geriatric community and those that serve them in the skilled nursing space. Today's Care Threads podcast will center around the topic of leveraging technology and analytics to improve care coordination. Why is this so important? Skilled nursing staff are being required to wear more hats than ever, and technology can be used to increase efficiency to do more with less and tap into analytics to identify areas of opportunity to better coordinate care. Amy, thanks for joining me.
Thanks for having me.
Let's get started.
Okay.
Share with the audience your career path. How did you get your start in this field, and what has your journey been like in your role today?
Well, I started on my career path right when PPS was coming into fruition, so that was interesting. My first day on the job was actually Christmas Eve, and so I think I've been from, starting from being a clinician to direct care to taking on more regional and divisional roles. I've worked for very large companies, and Sava being one of those, in wearing multiple hats. And I think, having a therapy background and then working with our MDS teams, I grew throughout my career to love and appreciate MDS nursing, the strategy and the reimbursement rules and the quality that surround being an assessment nurse. And so I grew with that path and really started to embrace that throughout my career. And what's interesting is back when I started, you had a handful of managed care plans and HMOs. And so now we're seeing what a shift in the world, right? So now we went from almost, dead even Medicare managed care, Med Advantage to now that superseding. And so the roles of clinicians have had to change and morph with the industry morph. And it's hard. It can be hard. However, I would say the best change agents in any type of healthcare industry would have to be long-term care, because it makes you a great clinician because you have to be able to do so many things. And like you said, wear so many hats. So.
Wow, that is quite the journey and background to get to where you are today. Something jumped out at me and it's a word I've not really heard used a lot whenever you think about the evolution of kind of reimbursement models, is being focused in on strategy as it relates to kind of the evolving role and how you're having to wear multiple hats. Do you see a lot of other organizations kind of taking a new look or a new strategic approach to how they're staffing and focusing on that?
Well, if they haven't, they need to, because I think we're being forced to be honest. We went from these assessment pieces and reimbursement that was really just data entry back in the day. And then PPS sort of changed all of that for us. And every single update, they've added not just one layer, but a whole, salami sandwich onto it. So it's gotten really thick with a lot of data. And when we had the update in 2019 with PDPM, it was a full shift, full change, and we've added 160 reimbursement questions just in one assessment. And that was huge for us. And so you have to engage not just rehab or not just psychosocial services, but nursing has become the primary driver. And if we don't have our arms around nursing care and documentation being at equal stance with one another as a nurse, as a clinician, then we will miss the boat, because we have to learn to empower our nurses to take credit for everything they do, empower our CNAs, empower all of our staff, because, we've gotten a little bit of the shaft, to be honest, in long-term care. And it's such a really beautiful group of people. And to be in this field and this part of the industry, you really have to love it. You have to love geriatrics. You have to love a psychosocial model. You have to really embrace that look. And, you're really seeing it filter out now as staffing has become so challenging for everyone. And I really don't see it easing up, anytime in at least the next year, we're going to have to deal with this. So it becomes critical that everybody's able to sort of pivot and change and learn from each other and be transparent,
Absolutely. Well, and that pivot and change, and you use the term nursing as the primary driver. How do you see that coming into fruition, or how have you guys done that to put the nurses in the driver's seat?
We've done a lot of education, a lot of training, increased our communication. I will say that. And one thing I think that Sava has done really well, and I've been with a lot of other players in the industry and met some wonderful people, but I think what Sava has done really well is they've really said, okay, from our leadership on, we are here to support the field. How can we make the lives in the field easier? And nursing care needs to be at the forefront. So how can we help the nurses deliver the care efficiently and take credit for that? And everyone should be involved in understanding the metrics, including the nurses. So our nurses honestly didn't understand the metrics nearly as well as our therapists did for years, right? Because RUG's world really was driven by rehab. But now, case mix groups are driven by nursing. The nursing case mix group is the highest one. The NTAs are driven from nursing and diagnoses and meds. So you've got these two big components that make up the reimbursement. And so you've taken these nurses that didn't really care to know about it to, hey, not only do I need you to care, but I need you to drive it. I need you to ask questions. I need you to use your, clinical deductive reasoning and become also an operator. And they don't all like that. That's been hard. But I think if you give them the tools and the support, obviously the technology is, you can't do it without the technology. So because there's too many things to juggle right now, and they feel it. So you have to support them and listen to them and give them what they need, and also, strategize and triage the plan to make sure that you get, everything met, including, paid for all that you're doing. There's nothing wrong. There's nothing ugly about nursing homes making money for the care they deliver. We have extremely complex patients that we take care of, and the government has really deep rules and regulations on us as well. And so you have to become fluent in those languages, I think.
Absolutely. And I would agree with you. And, part of what you're talking about, the education, the training, and really it's kind of, you use the language of triage the plan. And the plan being part of the larger care coordination plan, I'm assuming, of that individual's needs, not just that point in time or what's in the windshield now. With that, care coordination has been pretty much a buzzword, more so than reality for many skilled nursing organizations. How has your team leveraged technology to help improve that and driving that?
You've got to have care coordination folks in those seats that really understand detail, are able to communicate effectively, and have just as much urgency around the issues that you do, and know what the customer's urgency is, right? The customer being our patients, the insurers, the physicians, et cetera. And so what's happened is, because we've seen managed care supersede Medicare, we've had to learn these multitude of plans and all of the different requirements. And there's no way that you can have, facility nurses and MDS nurses understand all of the ins and outs of that. So we've created a lot of different custom reports so that we've been able to help set them up for success, right? So having some oversight from the regional folks, being able to look at skilled change reports, people that go in and out of the hospital, people that have a lag in their ARDs, people that are missing meds, authorizations, all those little detailed items. we need to have reports that can flag us quickly to see who might need our attention and help. And so we created, we used to have, instead of cutting from the facilities, we would never do that. You have to streamline down maybe your overhead some. So we had to do that, but we did it, I think, in a smart way. We took, that role that a lot of those folks were doing from the field, and we put it in more of an oversight role. So you kind of have this big brother in a supportive big brother way, going through these reports, finding out who's got the biggest issue, who needs my help, and then I can make those calls to say, hey, you're missing an authorization here, or hey, I see this high cost drug, you should get paid for that, or you might want to ask for an increased level of care. So you've got these sort of watchers, these nurses that we've hired, these remote nurses that are managing 50 buildings each, 40 buildings each from a remote location. But I will tell you, they have proved their value over and over again, because we have been able to really save our bacon, by identifying all that, because the intricacies of these contracts are there's no way anyone can know that. There's so many different rules and exclusions. So.
Right. And each patient or resident, as you define them, may have a different payer. So your staff on the floor may not actually be able to keep up with all the different needs of the managed care or payer relationships that you have. So if I understand correctly, then you are leveraging, you refer to them as the watchers, but really it's data empowerment to them based on the specifics of those relationships you have. And then from there, they're using that to help drive back to your floor staff to say, oh, wait, for this or for that, you need to do X, Y, or Z.
Right. We've sort of coined the term quarterback. So our MDS nurses, our care management directors, their role is not, their role has really grown as a leadership nurse in a facility. It's like taking your DON, ADON, and mushing them with an administrator operator brain to create this leader, this clinical operator. And so they're kind of the quarterback of the whole situation within the facility, because you have to have a point person within the building, right? You might have your oversight team and everybody managing it, but someone has to communicate, someone has to direct the information and prioritize what needs to get done quickly, because timing in this industry is everything in reimbursement, right? Timing is everything from skilled Med A to skilled managed care to HMO. Everybody's all about dates, times, length of stay. So you really have to be on your game. And our business is, 24/7. It's not Monday through Friday. So you have to find ways to be flexible with scheduling, flexible with weekend coverage and evenings, because, insurance plans don't really care if it's a Saturday night. You have to still treat this patient, manage their care, communicate to the floor staff, and make sure this patient's taken care of.
Absolutely. Well, and that flexibility with staffing, I mean, that is such a key issue in the industry right now is staffing, period. And, as we see, and I'm sure your organization is feeling the same pressure as the rest of the industry, as facilities are struggling with staffing, can technology be used to help offset that? And tools like Simple, can they be used to help streamline that care coordination while helping to improve the lives of the staff?
Absolutely. I mean, frankly, we can't really get through without having some type of technology to manage our schedules. And what we found was, a lot of our nurses were being asked to do some of these non-nursing tasks, these scheduling tasks, because you've got so much in and out volume and change in staff right now that having a type of scheduling software becomes really critical, a way for them to utilize an app, a way for them to go in and make their own schedule. If you ask the field, if you've asked these facility teams what it is they're looking for to come work for you, what makes it better to work here versus there, you really have to stand, alone and sort of say, what will it take? I'll do whatever it is you need. And the number one thing we hear over and over again is flexibility. So do I have an ability to come in when I drop my child off, or to work evenings, or can I schedule here or there and get my own coverage? Can I work 3/10s this week, and can I do 5/8 that, whatever you want to do. And we just have sort of said, you tell me what it is you need and we'll figure out a way to do it. So flexibility, number one. Yes, money is important, but honestly, getting the nurses where they can treat the patients and they don't have to do non-nursing duties, especially HR. HR takes up most of our clinicians' time. And so can you find someone that can take on those non-nursing duties to offload from your DON or ADON or whatever that might be, and then empower the facility teams on how to use software to schedule themselves and use their apps. Most of our CNAs are younger and they are frustrated if they can't use technology. They want something that's fast at their fingertips that they can manage. They don't want to have to deal with old, paper plans. They need to be able to put everything in something electronic. That's what they're used to. And on that note, what's funny about the technology boom for all of us in this industry is we have to make sure that our data lines can keep up with it. So we've had to do a lot of upgrades, and our plans are continuing to upgrade through this next year to make sure we can handle the volume as we increase iPads, as we increase, laptops for people and vital sign carts for things to integrate. And that's the other thing, the flow of communication makes their life easier, right? So the integration of all of these tools into one platform is critical. A great thing that Simples did with our EMR was we were now able to transmit our assessments right through Simple and have it scrub right there. I don't have to click in and out of a couple different apps. And honestly, I think a lot of our operators forget sometimes what it's like in the facilities, but even just those small little time suckers of clicking in and out or things that don't talk to each other and I have to double document, it can make or break your team's, joy of their job, and they'll find somewhere else that's a little more integrated. Technology is one of the questions we get in interviews now all the time. What's your software program? How long do you usually get things back from CMS? How can I get to reports? What reports do you offer? You'd be amazed how educated some of these clinicians are coming in about what they want in their job satisfaction. And to take a nursing job, they want to know, how easy is it going to be for me to document? How flexible are you with my schedule? And if I need a tool, will you offer me the tool I need to do my job? So.
Absolutely. So if I'm hearing you right, it sounds like there is a monumental shift in the industry as well from the staffing perspective of they want the empowerment of technology. They are not offended if, for example, a tool tells them, hey, did you forget? Or maybe you should have looked at X, Y, or Z. They're more open and willing to leverage that as part of their job now.
Yeah. And it's funny because we're used to that in our everyday life, right? I have a light that comes on in my car that tells me, and I'm like, oh, shoot, I've got to go get my oil changed, or, oh, something's wrong with my tire. It's the same thing in everything. I'm busy. I'm working hard. I'm treating patients. I'm trying to follow. And a little alert says, hey, you might want to think about, does this patient have this diagnosis? That makes sense. You're missing a point. All our nurses love that. They're like, thank you. Like it helps them do their job more efficiently. And they don't want to miss it either. They like having pride in their job and feeling like they've done they've captured everything they want to capture, and they've had these great relationships. They get excited about it. So no, if anything, I think they're looking for something that is very intuitive and helps guide them to the path. I mean, there's nothing wrong with a helpful tool. That's for sure.
That's great. And do you think that's a byproduct of kind of that shift to PDPM in 2019? It was such a monumental shift in how we're getting paid and reimbursed. Do you think that as part of that learning curve, the technology was seen as an assistance rather than, hey, I've been doing this for, 10 years. I know better than any software?
Yes, I would say the nurse that said I've been doing this for 10, 20, 30 years was freaking out a little bit because it's so overwhelming, the amount of volume. And they're saying, help me. What can I use to help me do this job better? So, PDPM, having some type of technology that alerts you when you're on a bubble for another NTA or something that makes sense with a patient's comorbidities that you might have missed something. There's too many items on an assessment to not have technology help guide you. You could take the best, most amazing REI coordinator out there, and they still would want that technology. You'll still miss something. It's too complicated. survey process as well, quality measures as well. You need all of those items to stay on top of everything that the industry is demanding of you. Insurance companies, physicians, pharmacy. I mean, it really is a lot to juggle for someone that comes out of school wanting to just, treat patients and write a care plan. And they think that's what it is. They don't teach you any of these things in school. It's a lot of on-the-job learning. And so you need leaders in there that promote it, support you, give you time to learn it, and you can feel satisfied at the end of the day,
And absolutely. Well, and you bring up such a good point, though, is, in school, they're taught to actually provide the care, right? Administer the care. And it's not really, they're going through to be an IT resource. So they're not learning the ins and outs of technology. With that, do you think it's important, or how important is it to have analytic tools that are simple enough that anyone can use and leverage those in their day-to-day?
Analytic tools are critical. And I will tell you, it can be the reason why you stay with a company like Simple and switch from the company you're at to go to Simple. And I will tell you, the number one reason would be the predictive analytics, the ability to get in front of everything. We are a very, or at least historically, I will say, reactionary industry. And we have to become extremely proactive, getting in front of these quality measures, getting in front of the survey issues, a way to round better, because, you have all of your different insurance partners that are looking for your strategy, your trend, how you are implementing a change, and then showing them the results of that change. You can't do that in a reactionary world. You really have to stay in front of all of your issues. So you used to have your therapist and your MDS nurse that were really good at the software and could use it. But now you're seeing all of your clinicians, all your social workers, your activities leaders, your business office teams, they all want to learn about Simple for us and with our analytics, for example. And they all want to understand, what's the frailty of this patient? And I need to pull this up so that I can manage my rounding with my team. And I only have this much time, so I should probably just, I'm going to look at these 5 residents right now because they're critical. Dashboard information, making sure that you don't lose money. And, the quality reporting, like the QRP measures are just going to continue, and we're going to be reimbursed from QMs. I really believe it's here, it's coming. And so the better that everyone can get at understanding how to utilize the analytics to manage their care, the better off we will all be, really.
Right. Well, and with that, we focus on your organization in terms of the need for analytics, but it's also taking that analytics of your organization, using those to go to your managed care, your payer relationships, right? And how do you see that kind of evolving, or how has it evolved for your organization, and how has tools like Simple helped to drive that evolution too?
Our managed care partners, they want to know how we stand up against our peers, the national averages. And if we are struggling with something, they want us to tell them and then show them, what we've done to change that, how we've identified our population standing out versus another population because we're taking on these types of patients. That's been something we've really run into a lot this year with our VA partners, with all sorts of insurances, honestly. And they will pick and choose based on those quality measures who they're going to work with, send their patients to. So for the operators, out there, it becomes a vital tool on, census growth and ability to bring those patients in and build those relationships, because we see those networks just narrowing and narrowing every single year. And boy, we're really in it now. And why wouldn't they? It's very competitive. They want to be finding the best providers. And so they're kind of, unfortunately, the insurers have been sort of in the driver's seat now, and they're saying, okay, we only want to work with the best that have this type of staffing, these type of quality measures, offer this type of, programming for our types of patients. So it really becomes a partnership, not just from your sales and marketing team, but now your nurses need to understand that. Your admissions, your business office needs to understand that. Administrators are getting very involved in a sales and marketing role to work with those partners to really build those relationships, which I think that's really changed over probably the last 4 or 5 years, and it just keeps accelerating, right? So having a tool where you can show them your data, show them your trends, it's easy. I can just grab it because somebody canceled my meeting and I just grabbed another meeting with somebody else from another hospital to build that relationship and try and get in with them. It's nice to have tools like that from Simple where I can just easily navigate, right? I don't have to be the nurse. I could be the sales and marketing liaison, and I understand I can go to a quality measure and pull it up, or a diagnosis, and say, these are our primary diagnoses we're seeing in this facility. And we've been teaching them how to use that because they need to understand how to go in and show that data to our partners out there.
Absolutely. Well, and from your seat, do you really think that care coordination could be done without having proactive analytics?
Absolutely not. And that, it's funny because I don't know how people do it to be honest, without predictive analytics, to know, yes, I might be a 3-star, but I'm moving to a 4-star or a 5-star. And I'm really on the fence here with my points. Simple's fantastic because you can just hover over and see how close you are with points. You can play with it a little bit to see where you need to focus your energies, if it's on the staffing piece or if it's on, your complaint surveys have escalated or wherever that might be. Really allows you to sort of slice and dice your plan within each of your facilities, districts, regions, whatever you manage. And for us, from sort of a high level view, I'm able to talk to our board members and, our investors and show them the predictions that we're looking at, what trends we're seeing, our QAPI plans that we've put into place. They want to hear all that. They want to know, why should I give you all this money to continue to staff and to support agency when you're in this, this rough spot? Well, because of this, we might have been struggling, but look at the, gains we've made with the tight staffing, and the quality measures that we're looking at. And, that's a great piece of data to have at all levels of any industry or any, organization.
Yeah, absolutely. And would you say that now more than ever, quality data is more important and critical than it has been in any other point?
Yes, and we've seen them put more pressure on quality, right? They've changed even, the expectations of quality, and we've heard from CMS that they're going to continue to do that, and so we're going to continue to see those numbers tighten. We're also going to continue to see, I think, payment be driven from quality measures. I'll tell you, more and more people in the industry outside of skilled nursing ask about quality measures, and now you have this group of folks like myself that might have an aging family member or whatever, and they are more educated. They go online, they pull up your quality measures before they even pick a facility. I know I do. I look at it all the time. And so everyone is getting really fluent with navigating through the internet and finding, care issues or places that look better than another and comparing to your peers or in that, geographic area. So it becomes really important to manage those quality measures because people are making decisions off of those more and more.
Absolutely. Well, and among the audience that listens to this podcast, it includes CEOs. From your perspective, what is the biggest misconception that CEOs have about care coordination? What is the biggest opportunity you think exists for skilled nursing providers to enhance those care coordination capabilities?
They need to understand, I think, that the industry has changed so much and there's so much more pressure on this role. It's really changed to having to manage so many different products and really understanding the ins and outs, and the staff in the facilities will not be able to do it without some help. We've got to give them some support because they can't manage all the different products. So care coordination, and honestly, having some folks in a centralized location help manage that and be a resource for the buildings is huge ROI for you. They're able to pick up thousands of dollars on these high cost drugs in this contract that you weren't even aware of, or to ask for increased levels of care or increased rehab for patients because they're able to dive into the data and make those decisions and help kind of guide the facilities, which then guide the care. You can kind of all sort of work together really interchangeably. And so putting some money in those, sort of roles and having them be sort of like we talked about earlier, the watchdogs, but having those nurses that really understand the summary of some of those contracts is critical. I mean, gosh, I think we've seen some of those HMOs that have you might have one title of Blue Cross Blue Shield, but there's 20 within that. And if you're like us, we're in multiple states with multiple rules and regulations. And, you have to understand the different dynamics within each of those contracts. So I really think that having someone that really gets that, can communicate effectively and help guide the buildings is a vital role. And it's going to just get larger. Like I said, we've just superseded our Medicare with Med Advantage and HMOs. We continue to sign these contracts every single day and add new, folks. They use these portals. And so having people understand how to go into the portal and access data to send to these insurance agencies, it is becoming a much larger role than we ever thought, I think it would be. So it only makes sense to have care coordination, be at the forefront, because you're looking at that patient even before they even come into your facility. That person is now sort of managing them prior. They're within our facility. They're constantly, having to be on a tight schedule to get them then out back to the community and then follow back up with them in the community. So you have to have someone that fully can manage that whole holistic view of that patient to ensure that they're successful when they leave us, because that will be important to bringing in another patient, and working with that insurance as we move forward.
Absolutely. And then what would be a piece of advice or a question you would ask or have a CEO ask of their team if they're listening and wondering, how well are we doing this today? What's a good question to ask of their team?
We did a survey of all of our staff and we asked them, what is it that you need to be happy to work here or to come to work? And I think having that conversation and asking them point blank, tell me, if you had a magic wand, what would be the number one thing besides money that you would like, to increase your job satisfaction? And it was interesting because that's where we heard, I want to just do nursing. I don't want to do all this scheduling and HR, which is taking up all my time. I need another computer. If I had another monitor, I could manage three, if I had, faster speed at the facility for data entry. It was interesting to hear the feedback, but they're very open to tell us, and I think the more we can communicate and build that bridge with letting them feel very valued, saying thank you for working so hard. These are hardworking individuals that really want to be there, truly. And it's been a very, very challenging 19 months or so, and it wasn't that easy before. So it really, was coupled with a tough time. So CEOs need to remember, ask your team what they need, because a lot of times it's a very doable, and not that large of an item.
For sure. Well, and part of what you mentioned, and you've talked about this kind of as an ongoing theme through our chat today, has been that, technology is an enabler. So not only is it going to help with creating efficiencies and insights, but do you think it's actually a strategy for organizations to deploy tools like Simple as a recruiting strategy?
Absolutely. Like I said, we get asked all the time, what software do you use? And if we say, well, we use Simple, they get so excited. Oh, I love Simple. I couldn't go somewhere without Simple. I remember I hired in a VP, and one of her first questions was, I don't know if I can come to your organization unless you use Simple LTC. And I said, well, you're in luck, because we do. And, she said, I just can't let it go because it's so easy, it's so intuitive, and everything sort of works together to help guide care. And it makes everyone's life a little easier. So I think you're finding more and more people ask for the software they want because they know how much easier it makes their job so that they can treat the patients. They can be there, caring for our folks.
Absolutely. Well, and I think you've done a really great job of kind of, telling the story of the empowerment of technology to help drive care coordination, how your organization's kind of leveraged it. As a final thought or a final question I'd ask you here as we kind of come to an end of our chat is, what is the biggest piece of advice you would give to someone who is about to revise or rethink care coordination for their organization? What's that one thing you would tell them to do?
I would tell them to hire smart. I would tell them they need to have someone that understands the contracts, that is an advocate for the clinicians and detail oriented. I, of course, am thinking of the person that we have in this role because she does such a fantastic job, understands all of the ins and outs of those contracts, and is a great communicator. I mean, the person managing that and someone that really can drive it and believe in it will make a huge, huge difference. She's changed the face of our reimbursement, truly. Our setup has changed the face of reimbursement with managed care. You have to have someone and people that understand those details that can tease them out from outside of the facility. There's no way that your facility teams will ever be able to get all those nuances. So I would say hire smart, that oversight person or people to help manage that process.
At NetSmart, we understand the challenges facing provider organizations. Our team will help you navigate changing value-based care models with solutions and services that make person-centered care a reality. We'll equip you with technology and services that provide holistic, real-time views of care histories that inform better decision-making and better outcomes. Visit us today at ntst.com. NetSmart, serving you so you can serve others. Thanks for listening to the NetSmart Care Threads podcast. Through collaboration and conversation, we can work together to make healthcare more connected than ever before and better support the communities we serve. To ensure you never miss an episode, please subscribe to the show in your favorite podcast player. If you use Apple Podcasts, we'd love for you to give us a quick rating for the show. Just tap the number of stars that you think the podcast deserves. Until next time.